Thank you to all of our speakers. You can see how individual our journeys are, right? But again, the shared threads that we have, the pathway to some of the answers for us is just kind of amazing. We're going to now just go into a panel discussion. Does everybody have their speakers on? Could you go ahead and turn the speakers on? Right. And just maybe pick apart a little bit more the different phases of the journey that we've been through. I think you've heard from everyone about the kind of the impact factor. What did this do to me as an individual? I want to just probe that a little more and see if there's anything anyone wants to share about what this, really kind of starting with the symptoms and how they impacted us in the early part. Ruth, could I call on you to maybe kick off that conversation?
I mean, significant was what I've written down in my notes, which is a bit of an understatement, really. I think some of it, when you're first diagnosed, is coming to terms with the fact that it's those words, this is not curable, this is progressive, and that plays on your emotional health an awful lot. And I really, really struggled. And I think dry eye disease in particular is quite isolating, and I can split my friends and family into the people who get it and the people who don't get it. And the people who get it are usually the people who've had a chronic pain disorder or a chronic illness or just something that impacts upon them. And a lot of people out there really just don't get it, which is why I think community is so important. But no, for me it was absolutely devastating. I really struggled mentally with these sensations that were there 24/7. And a lot of coming to terms with the diagnosis was, as you said, just getting used to that and getting used to the fact that my eyes don't feel normal most of the time, but I can tolerate it and live with it most of the time, flare-ups notwithstanding.
Thank you. I was thinking about this a little bit during Kathy's talk, and I love the way that she separated there's the physical problem and there's the mental health side and what this does. And the way I used to think about that and talk about that sometimes in the community was, you're seeing this balance. There comes a time, I mean, our eyes are just, exploding and cascading into our lives, the impact, right? But there comes a time when what's going on in my head is actually outshouting what's going on in my eyes, even though it all started with my eyes. And so it's meant a lot to me hearing that message come across so clearly that we have to tend that aspect. Anybody else want to dive in again on just the impact factor before we move on to kind of our pathways to diagnosis?
I can talk a little bit. So
sure.
I think the thing that blindsided me in the early days from an impact factor was the load on myself to advocate for my care, and the financial impact, obviously. In the early days when my dry eye started, I had like my first job out of school. I wasn't making much money, and I remember back then the only lid heating protocol or procedural option in a clinic was, I think, Lipoflow, and the doctor said this will be $800, and I was like, I don't have $800 to be able to do this. And I was like, well, is this gonna solve this problem? Is it gonna make it go away? Because at the age of 22, you break a wrist or you get some sort of issue, and usually it resolves because you kind of feel invincible. And the doctor said, I don't know. It might help, it might not help. And I think that was the first moment where I thought to myself, shit, this may be something that is not solvable. And that's horrifying, very scary experience. I was fortunate enough to make it to that point with nothing that was chronic, but that was the first point in my life where I think internalized a little bit this idea of having a chronic illness. Over the years, I've also had a couple herniated discs in my back, which resulted in very, very severe chronic back pain. And so I think there were moments where I just felt like my body was a prison, and I was having intense pain in my eyes, intense pain in my back. I couldn't, do the things that I wanted to do, so I really felt trapped, in addition to spending tons and tons of money on trying to solve these problems that weren't being solved. So I think from an impact factor, I think there's an incredible financial burden that we all are taking on in order to support ourselves. There's a mental health burden. There's a physical burden. You're limited from some of the things that you may have previously loved to do. But I think some of the points that everybody touched on, and I'm sure all of you can relate to, is once you can stop labeling this as something evil and horrible that is happening to you, and you can see it as merely part of who you are, and then it's like, you know what, I'm going to have this be 10% of my awareness. I loved that pie chart. It's not going away, but it will be 10% of my awareness, and the rest I'm going to have presence with this person I'm having a conversation with right now, or this activity that I'm doing right now. So that's something that really helped shift the paradigm for me.
Thanks. Some of these things are making me think of the big survey that we did a few years back, and you immerse yourself in the community like I have for so many years, and you come to think you kind of know it all, and oh man, it was really cool to see some of the surprises that we got from the data in that survey. And picking up on your theme of the financial impact, I remember reading through people's responses on what they were spending on dry eye, and it was staggering. I mean, we asked about what you spent in the first year and then in subsequent years, and seeing people writing down thousands of dollars and tens of thousands of dollars in the first year or two especially was really something. Another theme that comes across a lot in conversations I have with people, and you touched on this, I think, when you first started speaking about it, is the burden on us to navigate. Anybody else want to touch on that?
What came to mind actually listening to you speak there, I would also almost describe it as a period of grieving, I would say, because certainly for me it cost me my career and it cost me my identity, because I still use the doctor title even though I no longer have a license to practice, and I think you go through a period of grieving for the life you thought you ought to have, but the life that you weren't dealt. And I think that's probably a process all of us go through, and then you come out the other side and you go, well, I can't feel like this forever because that's not living. I have to embrace the life I have now. And so I would almost call it a period of grief, and that you have to go through and let go.
Anybody relate to grieving? So, yeah. Went through my own career shift back there too, so I can relate to a lot of that. Let's talk a little bit about the journey to diagnosis, kind of what it took and how long it took. And I know you've all touched on that in your individual stories, but could we probe that one just a little, maybe in some fresh ways? Natalie, do you want to share on that at all?
Yeah, sure. Yeah. Can you hear me? So diagnosis. Initially, of course, you get diagnosed with dry eye, but then it's like, okay, well, what's causing this dry eye? And that's the part where you have this diagnosis, but it's just so complicated to know how to approach it. And you're trying all the things. I mean, I tried initially, like I said, it was warm compresses, lid wipes, over-the-counter, preservative-free, artificial tears, but then it got to the point where there was so much inflammation, and the Xiidra and the Cequa just weren't cutting it. And so I tried so many different things. I feel like I was basically a private investigator, or solving a crime, and I was slowly piecing together all of this information. And one thing about me is I'm really determined and annoyingly curious, like I said, and so even though I agree with you so much about the grieving factor of this, because there was so much depression and anxiety when I was diagnosed, and like dealing with all this like burning pain, and like I couldn't keep my eyes open and I couldn't function. But there was also this almost like anger, or maybe it was anxiety or something, kind of propelling me forward to just be like really dogged and like dive into it. And I became obsessive. All I did was, my poor husband, all he heard about was dry eye, and that's like all I talked about and thought about. And that's all I researched. Like my entire, when I wasn't working, which was brutal to keep working, but I didn't feel like I could stop working. As we talked about the financial burden of this disease, it's like you have to keep working to fund it. And so all my free time was diving into reading research papers, getting on the Facebook group, Google. And I was just like obsessed. I have notes of just all this stuff. Well, let's try this. And I was constantly just thinking about it. I was like, well, and honestly, that was really empowering for me, was self-education, educating myself, because then I knew how to go and advocate for myself with my doctors. I knew what to try that I could try at home. And I've done, like I said, I've done APL, I've done probing, I've done, for the beginning part of my journey, warm compresses were my friend. They eventually became my enemy when they made the inflammation worse. I've done diet modifications and all the eye drops, importing stuff from Germany and like trying to find all these solutions, and really came to, honestly, the person who's most helped me is myself. Like at the end of the day, like, and the information that was available to me online, finding it, and just kind of, no one knows you better than yourself. So I think a lot of this journey is about, as exhausting it is and as hard as it is, especially since a lot of the research requires screen time, I think a lot of it is just being really determined and like not taking no for an answer and saying, no, there is an answer. And I might not understand it, and it might take me a really long time, and it might not be something I can treat right now because maybe it's not available to me in my country, or, based on financial means or whatever, or it's just not out yet. Like we're eagerly still awaiting drugs to come out. But I think that like that doggedness allowed me to realize I had mast cell activation syndrome. So I'm on a low histamine diet. I'm trying to heal my gut. Treating things like H. pylori really made a difference for me. I noticed all this systemic stuff was connected to my eyes, and I noticed when I would eat certain things, I would have flares. And so it was so much work over so many years, and this, routine that I have down now. But most of my stuff is hormonal, immune system, gut related, and finding out those connections honestly took forever. And I'm kind of just realizing more of that even just this year. Like I said, I've kind of started to get better this year, and I'm seeing positive changes with those, and some of them are so painfully slow to notice benefits, but so that's a lot of that is kind of encapsulates my journey.
It's such a puzzle, isn't it? This
Oh my gosh,
thing
yes. You have to be willing to like dig into the puzzle and just like live with it, and be okay with like the pieces being like funky and missing, and like
there's this bit that just does not make sense at some level. That you get this phrase, dry eye. I mean, could anything sound more banal? I mean, it sounds very common, which implies straightforward and simple. If a lot of people have this, then, there's a pathway to deal with that, right? But in my experience, our journeys through this so often are like the journeys of people with rare diseases. And that's we see that reflected, I think, in our pathways through the medical system and the doctors that we interact with. Can we maybe seg to that now? Just that pathway with doctors. I'd love to hear about, like, to what extent you felt you were driving the process versus your providers driving that process to diagnosis and solutions. Go ahead, Ben.
Yeah, that definitely resonates. As an example, in order to get my surgeries covered by insurance, I literally wrote my letter of medical necessity for my insurance claims. My doctors didn't really know what to write. to be honest. Did not understand my clinical policy bulletin, the clinical policies of my insurance plan. In some ways, I don't blame them for that because they're focused on so many things. But that's kind of an encapsulation of the fact that like I had to bear so much of the burden myself. I read it myself. I understood it myself. I understood what would get it covered. I wrote the letter and I took it to them and I said, "Do you agree with this? If so, will you sign it?" On the topic of diagnosis itself, I think something relevant to this, and also what we were talking about a little bit earlier, is how my doctors, like one could argue that actually in their diagnoses of me, they were not wrong. They were just incomplete. So it was not wrong to say simply that I had dry eye. It was not wrong simply to say that I had meibomian gland dysfunction. It was not wrong to simply say that I had evaporative dry eye. It wasn't wrong to say that I had sleep disordered breathing. It was not wrong to say that I had malocclusion, right? But it was on me to connect the dots and to say, wait, something's going on here among all these issues that's deeper, and that if I can, I want to solve because it's the underlying problem, right? And so then once I realized that truth, then it was on me to find the doctor or collection of doctors who could fix that, which for me was obviously like an anatomical issue. And I think there are versions of that in the stories that we've heard today and in the stories that I'm hearing talking to people, right? Like, it's not wrong to say, that, to say that we have MGD or lacrimal gland dysfunction or blepharitis due to Demodex mites, but like, what is causing that? Is often the question that we have to ask ourselves because we're not satisfied with that kind of superficial explanation. So what we mean by diagnosis and what would actually lead to progress in terms of the patient's symptoms and experiences, I think, like the deeper question, and that's really hard, So I think the journey with doctors for me has been like, okay, I meet with someone, I get their diagnosis, I meet with someone else, I get their diagnosis, and then trying to connect the dots over time, and then taking the mantle myself to figure out what does that mean for which treatments, surgeries, doctors I should seek from here, was my journey. Yeah.
Thank you. I love how you describe that. And I mean, there's just, what I was hearing was this kind of critical shift from this place of, is somebody out there failing me, or do I get to this place where I am empowered to take some steps in this myself? And I don't know, that can't quite express it, but just what are my expectations of others? What are my expectations of myself in this thing? It's a profound journey moving into that space of self-advocacy and what it means to you in there. And another thing I was hearing was this difference between diagnosis, as in somebody has decreed, here is a physical thing wrong with me, versus I have this problem, I have eye pain, I have whatever symptoms I have, what is the explanation of those symptoms? And those two things do not always coincide, right? Go ahead.
I think something that I would love to add to what Ben was saying, when you're diagnosed with a severe disease or health condition, I think a lot of people think about, like, why is this happening to me? It's a very like victim-oriented mindset, where you are, and that's normal, and it's okay to be angry at the situation and be anxious about the situation. And I think only until you can shift towards an advocacy mindset where you no longer are the victim of circumstance, this just is your body, this is your experience, and that's okay, but I'm going to advocate for myself. It's not looking to, there's some amazing doctors in this room, and frankly, there are some amazing doctors that have saved my life over this dry eye disease. But it was me advocating for my circumstance and building a team around me that could support my my health and my happiness was the paradigm shift. And I think that's kind of like, you know, similar to what you were saying, Ben, in that every doctor you see is a piece of the puzzle. I like your analogy too. And you need to start putting the puzzle together and be an advocate. You need to build support around yourself with our community, with mental health experts, and you know, and give back and help others in that journey. And so I just can't say that enough, shout that enough from the mountaintops, in that it's like switching from this victim to advocacy mindset where I think people start turning the corner.
And we get to tap into each other for that process too, right? We are a community. I'd like to, just closing out this session, have each of you share for a minute or two a little about your then and your now, where you were, where you are now. So I know one of the biggest need in our community, hands down, is hope. Ben, could I ask you to start, and maybe we could just...
Yeah, sure. I mean, you know, I didn't really bury the lead with this one in my speech earlier, but I'm cured. 5 years ago, 7 years ago, I was, you know, I would wake up and I had a 45-minute to an hour-long ritual that I just had to do to start my day and get through the day, right? Today, it is, that's just something I don't have to deal with. I can't remember the last time I put in an eye drop. Like, it's absolutely mind-boggling for me to think about that. It is lucky that the problems I experience now are like mental adjustments regarding sort of how I look, and you know, some body dysmorphia that I've dealt with in therapy, and some facial kind of numbness and heaviness at times as a result of the multiple surgeries I've had to do. So, you know, I kind of get down sometimes about, you know, what I'm still going through, but when I remind myself of just where I was and how desperate I was, you know, 5 to 7 years ago, like, I have to be grateful for it. So, yeah, I don't know that there's much more to say on that, but like, it's night and day for me. And I don't say that braggadociously. I don't mean to be glib. It is just my experience. Yeah, you know, I'm here today, and I talk to patients on a regular basis just in order to be able to share what I can to help others. Yeah, that's it.
Thanks, Ben.
So where I started with, at my worst, when my eyes were like bloodshot red, my face is all flushed, you know, everything is, I could barely keep my eyes open. I mean, it's a pretty stark contrast to where I am now. I'm wearing makeup. Like, that's crazy. Also, thank you, Dr. Perriman, for your makeup tips and product list, because knowing, like, you know, what kind of things you can put on your eyes that are dry friendly is so great. But yeah, like, it's extremely stark. And I still struggle, like I mentioned. I still have to do a lot. Like, I still have the routines and things. They're not as bad as it used to be. It's kind of just you kind of just get used to it. But where I started with the bloodshot eyes, and actually I wanted to say Christmas 2020, that was really rough for me. That was when everything went, I don't know what was going on in Christmas 2020, but that was rough for me too. And it's wild to think of how depressed, the suicidal ideation, the anxiety, it was so intense. And just the restlessness, just so much anxiety, so much research, just constantly trying to figure this out. I needed to get out of that hell. And how much more, like, I no longer have suicidal ideation. I'm no longer, like, I still struggle with things like depression and anxiety, but I'm definitely improved. I have a much better outlook on life. I have a beautiful daughter that I was able to have. Like, that brings me a lot of joy and purpose. And just the more that I was able to educate myself, that gave me so much hope. Like, I constantly preach this. I'm like, educating yourself and understanding what your condition is and how it works, how the eye works, then you can start to, for me, it was like I could start to put these pieces together and I could go, I know where to spend my dollars. I'm no longer freaking out, like super stressed about where to spend my money, because this is obviously a costly disease, because I'm thinking, based on everything I know, I think this is probably where I need to put my money this period of my life, or this is the thing I need to try. And if this doesn't work, it doesn't mean it's not that, but maybe it's something else. And just like being really, really curious, like that curiosity, I think really kept me sane and gave me hope, because I think, like I keep saying this, but the puzzle aspect of it kind of just made me, I think there was like some hope in that. And it didn't feel just like I was spiraling and I was out of control. I had like a sense of control over it. And so I think all those stuff, honestly, this has made me like a tougher person. Like, this is the hardest thing I've ever been through. And I've been through some stuff, prior to this. So I think having that outlook, knowing how to manage my health better, being more in tune with my body, being able to advocate more for myself has just been honestly really uplifting and hopeful. And so I'm really grateful when I reflect back at like the contrast. It's really stark, and there, like, it maybe sounds cheesy, but I feel like there is hope, So I'm really grateful.
Thank you, Natalie. So Ruth and then Justin, and then we'll be heading into our coffee break.
Okay, so I guess if you view the journey like a sort of a canyon or a valley, when I was at the bottom, my husband would come home from work and he'd say, I knew what kind of day you'd had, because if you were downstairs, you'd had a good day. If I said hi and you said hi back, I knew it was an okay day. If I said hi and you didn't reply, I knew you'd had a bad day. And there were the days when I couldn't get out of bed and my pain was waking me up in the night, and I felt the lowest I've ever felt in my life. Where I am now, I would say I have come up the other side of said valley into the green pastures beyond. So, I'm not cured, but I'm stable, and I have learned how to live with my condition and the things I have to do, the vigilance with the drops, I wear moisture chamber glasses all the time, the adaptations you have to make to your life. I know what to do to look after myself. I had to look after my whole health. I had to realise that how I had been living as a doctor wasn't very healthy. I wasn't eating properly. I wasn't exercising enough. My sleep was appalling. My stress was through the roof. So I fixed all of those. And I guess, as Natalie said, what it's shown me, it's given me new skills. It's shown me that I have a resilience that I didn't realise I possessed. I always used to say I was less glass half empty, more glass on the floor and the carpet's wet. I would now say I'm definitely more glass half full. And whilst I don't know, there's a high chance my dry eye disease may go a little worse as I head through the menopause, but I'm prepared mentally. I have my mental health toolkit. I know what to do to look after my sort of mindset, and I know what to do to look after my eyes. So I face it with a resilience and less fear, and it's nice to be out the other side.
Thanks, Ruth.
So one of the therapists that I met with said something to me years ago she said, the greatest amount of growth in your life will come from the greatest loves and the greatest amount of pain that you will experience. And I think that is definitely applicable for this. For me, my dry eye journey was like a slow decline until 2020, where I would say it like dropped off the map, and I definitely hit the floor and was struggling for several years. That was a turning point. There was a phone call that you talked to me for an hour, Rebecca, and I was floored that this person I had never met before would be willing to talk to me on the phone for an hour about different dry eye products, and that gave me hope that there was power in community, and I started kind of shifting more towards advocacy for myself and then leaning on others to learn more about what I could about this disease. And then actually a few years later, I ended up in the ER because my disc herniated so badly that it cut off function to my right leg. And then I spent years recovering from horrifically painful back pain, like truly horrible. And that taught me that even with dry eye, and you think this can't get any worse, well, life is going to hit you from different angles, and different things can happen, and it might be other areas of your body, it might be loved ones, it might be your work or whatever. And I think through that, through those challenges, it sort of created the skills to be, as we heard, more resilient, more capable of dealing with the ebbs and flows of life. And so I think that now, I'm also, I would say, somewhat stabilized. I have very significant flare-ups now and then, but I built the skills and the tools and the community around me to be able to manage them. You know, my partner, she can tell when I'm having a bad eye day, and she said, you know, I can tell it's a bad day today, and she pulls out some drops out of her purse. And so I think building that community with your family, with in Facebook groups, with your care providers is just critical to keep us in a state where we feel like we can focus on all the other beautiful things in life, and keep positive outlook.
All right, thank you, Justin. Can we thank our patient panelists here? This is really great.